Well, I think when you look at the pandemic as a form of a disaster, which it really was, that true disaster response recovery depends on relationships. Helping to identify ways to respond to the needs of the communities is really critical. And that's what I think has been a credit to the Big Island, having a real strong community network where people come to the aid of one another and support each other.
You know, this has happened time and again to our people. And so for me, it's very personal because I know that the only reason why I'm here is to make sure that nobody gets left behind. I joined Premier Medical Group, which was founded by Dr. Scott Miskovich. He's my mentor and my boss and my Oahu counterpart. We're a private practice, fairly small, but we're family medicine. So the nice thing is we can provide full spectrum of care. I've officially kind of taken the clinical services aspect for the Big Island, both in Hilo and in Kona. In Hawaii County, we're the only mobile clinic, so we actually take the services on the road to the people.
You consider the very rural nature of this island. That type of service with community-based outreach is just invaluable because when you make it accessible, closes gaps that otherwise people would be suffering and not able to access critical services that help them to stay safe and be healthy.
And try to overcome a lot of the geographical barriers to care, as well as kind of the socioeconomic barriers that stop them from being able to access care. When COVID arrived, and I think we're the first in the state to do the large drive-through testing models, we were at the forefront of testing from the very beginning. So that actually means that we could provide that subject matter expertise for consulting for businesses, community leaders, for even government.
We initially reached out through Department of Health because we had what we thought was a exposure concern in a workplace. Dr. Akiona and her team have been just great to work with. They provided great support with doing testing for our team. You know, it's ensuring the safety of our employees and that they understand the guidance that we all need to follow to reduce risk in our community, prevent spread. So having policies that encourage our employees, both on and off the job, to do the right things. And then it's providing opportunity for them to get tested and get vaccinated.
We've together kind of worked through how to support businesses as they kind of navigate the vaccine mandate. What does this mean for local employers and their employees? How do we support the unvaccinated without making them feel bad? So we do the rapids, we do the PCRs, we provide vaccinations and the booster shots as well. I actually have Regeneron on hand, so I've actually done some monoclonal antibody treatment in the field with people trying to prevent them from getting sicker.
So we're hoping that we're about to see some normalcy being restored with better vaccination rates, downturn in the numbers, that again people can start to enjoy family again, travel, and closeness that a community normally has.
Basically, we advocate on behalf of all the providers and the patients for just better care, no matter where you are, and just making sure that all districts of this island at least has equal access to care.